Hello and good evening, everyone. Welcome to another episode of our It's a Match specialty series, where we go over the ins and outs of a particular specialty. Tonight, we'll be discussing a crowd favorite, neurology. My name's Rabas. I am a final year medical student here at CMH Lahore, and I am an executive associate at MedAngle, Pakistan. Hosting with me tonight is Dr. Shahzaib. Dr. Shahzaib is a recent graduate of Dow Medical College and the director of marketing here at MedAngle, Pakistan.
Hello everyone, good evening. I am Dr. Shazib. I am also personally applying to the upcoming Neurology Match cycle. So it is both a personal and a professional achievement and satisfaction of me to be hosting this episode alongside our wonderful guests, Dr. Noor and Dr. Monim, right? So let's set us off. Dr. Noor and Dr. Monim, why don't we go ahead and introduce ourselves? Dr. Monim, let's start with you.
So, hi everyone, this is Mohammad Azib. I am a graduate of Lahore Medical and Dental College. I graduated in 2020 and I've been working as a physician in the neurological settings of the Gurki Trust Teaching Hospital ever since I graduated. And I matched in 2024, which is this year. I matched at Geisinger Wilkes-Barre, and this is in Pennsylvania. And unique experience in my USMLE journey would be that the culture and the educational background that I come from is a little bit different. Not a lot of people pursue USMLE in my college, and in this current math cycle, only 7 people applied, and six of them matched. So to be able to pursue something that is very unique and to be able to help my juniors and even my colleagues and other like-minded individuals it serves as a very good and learning opportunity for myself as well.
Thank you, Dr. Monim, for that wonderful introduction. Dr. Noor, why don't you take the stage?
Hi, my name is Noor Imran Khan, and I'm a graduate of Ziauddin University, class of 2018. I've been working as a postdoc research fellow at UT Health San Antonio in neurodegenerative diseases, and I matched at Michigan State University, Cornell Health in Grand Rapids. And so I've always been interested in clinical research, which involves studying interventions, diagnostic modalities, and medications. So my journey involved me working first as like a research assistant, then a research associate, and ultimately working my way up to a postdoc position in order to gain the experience and then make meaningful contributions in both Pakistan and in the States.
Yeah, thank you so much, Dr. Noor. For returning audience members, I'm sure you'll notice that Dr. Noor was with us on a previous episode as well, where we did a very deep dive into postdocs, how to get them, how to secure them, how to thrive in them. And so for anybody really interested in the whole postdoc business, I would really strongly recommend that you check out that episode. And with that, Dr. Noor, while I have you, why don't you tell us why neurology?
So I've been always really passionate about neurology. I'm fascinated by the brain. And the scope of research when it comes to neurology is vast. There are new discoveries being made every single day. And for me to link research with neurology together, that was a very appealing combination to me. And that's why I decided to pursue neurology.
Okay, that's very good to hear. Dr. Monim, can we hear from you?
So I suppose my experience for neurology begins back in 2017 when I was volunteering for WHO's polio eradication campaign in Lahore, Pakistan. And this was when I was provided with the opportunity to supervise teams. And part of the task was to manage these teams who were out there administering polio vaccines. So polio is one of the diseases which is not eradicated in Pakistan, and Pakistan is one of the 3 countries that still harbors it. I suppose that is where my journey began, and to be able to see a patient of polio in one of the clinical care settings, I thought to myself that I can make meaningful contributions when treating patients with polio or other similar neurological conditions, and to be able to change people's lives like that, I think that provides and serves well within my community. Coming from a family where I'm on the only physician, I think it gives me a huge boost to my self-esteem, and that is exactly why I chose neurology for myself.
Okay. Thank you so much, Dr. Muneem and Dr. Noor. Let's just get right into it then. Let's just do a quick introduction into neurology. Let's discuss, the average scores, the average publication numbers, number of spots, what the match rate is. So let's start with you, Dr. Monim. What does the average candidate look like? What does the average successful matched candidate look like?
So, an average candidate, I would say, would be a component of a reasonable number of things, including good scores, good clinical experiences, good home country work experience. People often ignore this part, and with that, coupled a few connections, networking, and a very well all-rounded CV. And I have some data points right here with me. I'm going to consider Pennsylvania, for example. That is where I matched. And the neurology positions in the state of Pennsylvania by IMGs covered a total of 20% of the seats that were available. Now, that may not sound like a lot, but the specialties where 30 positions or more were filled with US or non-US IMGs included three specialties: internal medicine, family medicine, and the crowd favorite neurology. So the bottom line is, I think neurology is a field that is very well invested in by IMGs. They like to apply there and to have a very well-rounded CV and experiences that are linked to this particular field, because programs are always looking for candidates who are interested in one specialty and who they think would fit for them. So I think these are some of the things that can add to a person's profile, and I think they can consider themselves a strong candidate when they're applying into a med sec.
Okay, that's very insightful. Dr. Noor, would you like to continue? Would you like to elaborate?
Yeah, so there was like a record number of applicants that applied this season, with the biggest boost coming from non-US IMGs. 28% of those IMGs applied to neurology. And in the 2023-2024 cycle, according to NRMP data, there was 23% of IMGs filled our neurology spots. So this was a 2% increase from last year's cycle, which is very encouraging because there is a shortage of neurologists in the States. And I don't think there's one size fits all when it comes to neurology, but for sure, scores are very important. Program directors do a holistic review of your CV. So while higher scores are definitely preferred by academic, research-heavy institutions, they will not be the only thing taken into account. What matters is like your enthusiasm, your professionalism, and your willingness to commit, and of course, having a true passion for neurology.
I think that sounds wonderful. Thank you for expanding on that, Dr. Monim and Dr. Noor. Let's move into US clinical experience. What are your thoughts on that? What should a neuro match applicant have when going into the match cycle? Dr. Monim, why don't you start us off?
Course. So I'm going to start with my own example. I had a total of 4.5 months of US clinical experience. And when it comes to it, I think it is very, very important. When I try to say that an applicant has to have a well-rounded CV, US clinical experience comes on the second position right after the scores. So for someone who is applying into neurology, it is very, very important. Let me stress this enough, that a person has to have at least 3 or 4 letter of recommendations and clinical experiences associated with these letters. And these experiences obviously provide you a very well opportunity to interact with the faculty members as well. So I think it is very important to have not only the letters, but also on the ERAS CV, there is a section for listing all the US clinical experiences. Of the 10 experiences, at least 7 to 8 have to be related to neurology for someone who is applying into the math cycle. When applying for US clinical experiences, it is very important that you choose IMG-friendly programs if you are an IMG, for example, and to be able to make a list and then pursuing the faculty members of those programs specifically and applying into those programs or observership. This may give you an opportunity not only to interact with the faculty members, but also to possibly secure an interview invite from the same program.
That's good advice. Dr. Noor, why don't you take us off?
Yeah, so I echo with all of those points. Just for a brief review, so there are three types of USCs: observerships, where you're basically just shadowing the preceptor. Then you have clinical electives, where you're working as a medical student, and in that you can write cases and present histories. And then you have sub-Is. So these are fantastic because you're on call, you're working as an intern, you're basically an acting resident, and you can really show how clinically savvy you are. Most medical schools in Pakistan have a fixed time off for electives. So if you have one or two specific places where you want to go and do an away rotation at, concerned about your ability to match, then do these audition rotations as early as possible. They're good opportunities to show who you are outside of the application packet, and they're good opportunities to just get great letters and network in general. Make sure you rock this audition, be the first one there, be the last one to leave, be show that you're committed and dependable. You don't need to know everything, just be very engaged and interested. Because when we go for these rotations, we go from the perspective of an LOR. But if you show genuine concern to the preceptor that you're concerned for the patients, it doesn't matter if it's a rotation in a university hospital or not. Your preceptor will just still see your passion and interest in this field.
Definitely, that's definitely a good insight. Dr. Noor and Dr. Monim, how about you expand a little into the, as you've mentioned yourself, the IMG friendly neuro space places that neuro applicants should rotate in, some few locations, a few uh, programs that are preferable that neuro applicants should look into, rotate into before the set for the cycle. Are there any?
Do you want me to answer that first? Okay.
Yeah,
So I'm going to go ahead and list the programs just to give an idea of the viewers who are listening to this video. I completed my rotations at UHS Wilson, at Advent Health Orlando, and also at University of Cincinnati, Cleveland Clinic. This one is in Ohio, not the Florida one. And another institute that I do know, but I did not complete a rotation at, is the one I matched at, is Geisinger. And Geisinger has actually two branches. One of them is located in Danville, Pennsylvania, the other one in Wilkes-Barre, where I matched. So these are some of the examples of IMG-friendly institutions. I know University of Miami is another good one. They do consider IMGs. So it's very important when you're looking for clinical experiences. I wouldn't want the viewers to make the same mistake I did in initially in the process, that I lined up some of my rotations in the programs who did not have a neurology program, for example. And it is important that viewers learn that IMG-friendly institutions are very important. So to be able to pursue that, I would say to make a list first before diving into it, before sending out random emails. I think it is very important to make a list of all the institutions and approach those faculties specifically. And you may not always get positive responses to your emails. Emails have to be very well written first of all, and you need to structure your emails. You need to attach your CV with it, and then you can send those out. But you are, like I said, you're not going to get positive responses all the time. But what I used to tell myself was it only has to work once, and once it does, I think that is all you need. And with that being said, I think I pretty much cover all of the aspects that are linked with US clinical experience.
perfect. Thank you so much, Dr. Monim. Dr. Noor, would you like to add on any?
So continuing on the same tangent, so the way you make your list is you can go through Frida and Residency Explorer and look at programs that are IMG friendly. You'll see that IMGs, if like they're 50%, 67% more, in a program, then that's the programs you should target and do your rotations away in. Texas is very IMG friendly, so is New York and New Jersey, just at the top of my head. So these are definitely some states that you should consider doing rotations. And I first did my research elective at Washington University in St. Louis. Not very IMG friendly, but gave me a great base when it came to like making mentors, making connections. So after that, I went to Baylor Houston for an elective in internal medicine. And then again, so the program director might ask you, how does IM play a role into this? So the first year of neuro is internal medicine. This is how you can show you have a foundation placed already. And then I did an elective at Jackson Park Hospital in Chicago, which does not have a neurology residency program attached to it. And then after that, I started rotating with my department at UT Health San Antonio in neurology. Again, that does. So make connections, network, make sure you know if your attendings are attached and affiliated with other university hospitals as well.
Makes sense. Thank you so much for that. These insights, Dr. Monim, Dr. Noor. Let's move on to the next subtopic, which is something that is pretty, it's taken the world by fire, right? Which is research and publication, right? So, what would your advice and insight be on going about research and publications to match into a neuro spot? Let's start with Dr. Noor.
So research experience and postdocs are very helpful. Look for them early, apply for them beforehand. It's been getting increasingly competitive. So having a postdoc for an IMG on your CV is very helpful, especially true if you're going to be applying for academic heavy, research heavy programs. So what the PD is going to want to see is, are you someone who's going to continue to work in academic medicine and over the course of your career? So it's only going to add to your CV and not take away from it, in my opinion.
Dr. Monim?
I do want to just
Yes.
interject just a little bit before we continue the topic. There is a cost benefit to, spending a year as a postdoc as opposed to just applying directly. How does that factor in? Does the year of graduation cost really is it balanced by the postdoc?
In my opinion, I think it is. Even if you cross that barrier and you're doing for say a year or 2 year long postdoc, most postdoc programs these days, they want you to commit for 2 years before you can start residency. What ends up happening is, what they see is, how have you constructively used that time post year of graduation in that postdoc? It's not just saying, I'm a postdoc research fellow. What have you done in that time? How many abstracts, manuscripts, papers, conferences have you been to for you to show that you've made an impact in this field in neurology? So I think that you do have to kind of balance your timeline with as to regards to how much time the postdoc's going to take. But then at the end of the day, you're getting to add some fantastic experiences to your CV. So, and these days, program directors, one can automatically read and see what makes a neurology applicant versus somebody who's applying to another specialty.
That's true. That's definitely true. Dr. Monim, would you like to continue on research and publications for neuro?
Yes, absolutely. When we talk about research, I think one may be able to classify into research into three broad categories. And I think the first one being remote publications or remote research experience, the other one being clinical trials, and the third one being postdoc research fellowship, like the one Dr. Noor did. So I think uh, research experience, not a lot of program directors or not a lot of physicians otherwise would agree with this, but those are important. With that being said, I think not a lot of applicants do have research in their resume when they're applying for a math cycle. So it is a very positive thing to have in your CV. I think it adds to your profile, and with the maths being so competitive, it's very important that you have at least one or two publications when you're applying into the cycle. Considering my own CV, I had a total of five publications, and but it's not the number, it's the quality of these publications. I think the journal that you're publishing into is very important, and in regards to where you're doing your postdoc fellowship, that it helps to have a postdoc position at an institute that is, again, very heavily invested in research and maybe even in clinical trials. For example, Harvard is there's a lot of research being carried in Harvard related to every specialty, not just neurology. Same goes with Mayo Clinic or Cleveland Clinic, for example. So it's important that viewers learn that when they're sending out cold emails or when they're looking for positions on site, they send out emails to institutions where research is being heavily practiced or is being done. And again, some institutes really do require. I do agree with Dr. Noor's assumption here that they require you to have a dedicated period of time for at least 1 or 2 years. So you need to you need to clarify and be absolutely transparent with your PI regarding how much time you're going to dedicate towards a particular task or a particular position. So I think that pretty much covers all of it.
Thank you for these wonderful insights. Doctors, let's move on to the next subsection, which is work experience. Work experience is something that's hard to come by, especially when we're medical students. Obviously, it does increase once you've graduated, you do your internship or a house job, right? And a little after that, you can work in other sections. But how important is work experience for a neuro applicant? Dr. Noor, why don't you start us off?
I think it's important. Your first job does not necessarily need to be related to the field of neurology, but as long as you can show you were in leadership positions, you were driving the project, you were doing something that was, actively contributing to the um, department in general, it will definitely count, and make a significant impact in your CV. PDs basically want to see, are you a resident? That will encompass all the qualities that they're trying to see. Are you resilient? Are you hardworking? Are you motivated? Are you respectful of your patients? So my first job was working at Al Khan University in the clinical trials unit as a research associate. So I was working with hepatitis and hepatocellular cancer patients. Again, not related to neurology. But having that experience in clinical trials is basically what launched me into doing a postdoc. And at the same time, I seek out other opportunities in the neurosurgery department where I worked on research conducting, which was on basically epidemiology of brain tumors. So if you can show side by side that you're willing to take the initiative and not just walk down one solid path, but broaden your horizon, that will definitely work in your favor.
That's a wonderful experience, Dr. Noor. Dr. Monim?
Okay. So I think work experience, like I stressed before, a lot of people ignore it. I think it's a very positive thing to have on your resume. Starting with IMGs, especially from Pakistan, I think the basic work experience that we get to start with is your house job right after your graduation. So I think a lot of people ignore house job specifically because during that time they would like to prepare for their STEPS exams, which is a very wise thing to do. I think it's very important to have a good score on your step two. But at the same time, if you can manage both your exams with the work experience, maybe after with house job and after house job, it is a very good thing to have, and it provides you with an important platform during your interviews. You get to share a lot of your clinical experiences with the people who are trying to interview you, and it gives you an insight outside of the books and the education. It gives you how and when to treat patients and when not to.
Makes sense. That's great advice. Dr. Moim and Dr. Noor, what's your take on work experience that's not fully related to clinical medicine, right? So obviously working as a house officer, working as an intern, or working as a research associate, you're in the hospital or the clinic, right? Acting as a doctor or as a clinician, right? What about experience that work experience that's beyond that? Obviously, some students and some doctors have freelancing or have some part-time jobs that are not strictly related to academia or medicine, but it could it be something that they could factor in to their application packet?
This is a very good question because I can relate to my own example to it. Before I applied for the med cycle and right after my house job, I did for some period of time pursue a medical scribe position, which is totally outside the realm of medicine. And I was basically taking notes and talking to patients on calls. I think it is very important because it helps you develop your communication skills, which are again very important during the interview season. It helps you. It helps you with the how to talk to the patients, how to get their histories, for example, and how to uh, prescribe treatments if needed. And it was a very positive thing to add, on my resume because I was able to add it to one of the 10 clinical experiences on the EDAS application at the resume. I think if one does have some sort of experience that is not medicine related, he or she may be able to add that to his or her resume.
Sounds good. Sounds very well. Dr. Noor, do you have anything to add to this?
So yeah, if you have experience that's outside of the realm of neurology, for instance, you're very invested in volunteer work, and it's meaningful to you, there's a section where you can list all of this. ERAS in the coming cycle is also going to be introducing a section on extracurricular activities, so that's just something to keep in mind. They want to see who you are as a person and what matters to you. And if you're involved in volunteer work or community service or what have you, these are things that are important for programs, choosing future residents that can basically not just train in neurology, but also contribute maybe perhaps to the curriculum, teach medical students. So there are many opportunities that a resident can pursue in neurology, not just like outside of like, medical training. So it's up to you to take advantage. So all of these different experiences on your CV can contribute. Like for example, you guys are running MedAngle, and that's not exactly like you're not seeing patients, but you're connecting physicians and students every single day. And I think that's going to be a great experience to put on your CV.
Definitely, I do plan to put MedAngle on my own application packet. And we've seen historically people, our students, our doctors that have put MedAngle in their application. They've matched and they've spoken about MedAngle at length, and it worked for them. Dr. Noor, you mentioned volunteer experience, right? Yeah, and that we have a separate extracurricular activities section coming into the application. So, how what would the two of you recommend students and doctors sitting for the math cycle to expand on the section? What could be possible volunteer experiences they could look into or work experiences they could look into?
So I think every medical school does have a community that's dedicated to community service and volunteer work. So Ziauddin University, where I'm from, has Scar Health and Welfare Aid. Then you have SIUT, Behbood for women. There's so many opportunities that you can just go out and explore. I think a lot of our us medical students do that.
Yeah, that's true. Dr. Morim, could you expand on this from a Punjab centric view?
Absolutely. I think volunteer experiences, and I am also going to couple hobbies with it, but I'm going to talk on the hobbies later. For volunteer experiences, people from Punjab and especially from my own medical college and from other colleges in Lahore, I think people have a hard time finding opportunities. But what I used to do was like I said, I volunteered for WHO's polio eradication program. A simple way to find volunteer experiences would be to just scour WHO's website and see if they have any volunteer work going on in your area or in areas where you tend to visit often. Uh, with that being said, I also volunteered at in Orlando, uh, which was in 2023, and I applied the same principle there. I just went to Google and I search for volunteer experiences around me. So I was able to volunteer at one of the facilities that was called Ronald McDonald House Charities. And this was located right beside Advent Health Orlando. And I went there, I was able to provide and package free meals for the families who were staying there. So basically, I'm going to elaborate on what this is. So Roland McDonald House Charities is basically a welfare organization that is dedicated to the patients and their families, for patients who are visiting from outside the state or outside of Orlando. They and those who specifically are struggling financially and do not have a place to stay by, close to maybe, for example, their own relative who is admitted into the hospital. These houses provide housing to their relatives and to the patients themselves. So it was a very unique experience in a way that I was able to participate with a friend of mine. We went there, we just asked if there was something available, and they said, yeah, for sure, you can come and package and maybe even cook in one of our kitchens. So none of us were very good cooks. So what we did was we just got pizzas from a nearby a restaurant, and we just delivered it there, and we packaged in little boxes, and we were able to provide those to the families. And that was a very unique experience in a way that I was able to list it in my ERAS as well. And one of the program directors asked me about it. So couple that with hobbies, I think it's very important to have a good hobby. I have a total of three hobbies that I listed on my ERAS. Um, I absolutely love astrophotography. I own a telescope. It's not here with me, but when I was interviewing for ERAS, I actually framed one of the pictures that I had recently taken from one of my telescopes and put it in the background. So a lot of my interviews simply began from this picture. I used to introduce that myself that I absolutely love watching celestial bodies from my telescope, and I love to photograph them. And this is one of the pictures that I recently took. And that is where my interview would often begin. And they would talk to me about it for most of the part, and they wouldn't even discuss my experiences with it. They were so fascinated by it that they would say that I've never seen or heard about someone practice this particular hobby. So that was very helpful to talk about in interviews. And uh, I would often mention soccer. I absolutely love to play and watch soccer. So that was another thing I used to talk about. I used to talk about playing the piano because I do that very well. So that was another thing. One of the program directors who I interviewed with, he and I had a very good discussion at length about the piano and some of the classical music. So again, it's very important to have volunteer and um, uh, hobbies, volunteer experiences and hobbies to have on your resume.
Wonderful, Dr. Munir. No wonder you matched in such a good program. I feel like hiring you myself. uh,
Thank
Dr.
you.
Noor, would you like to speak about volunteer experiences and hobbies?
Yeah, so they just want to basically see that you're a nice human being, that you're normal, that you are a well-rounded person, because residency is very stressful. In neurology, it's for 4 years. It's going to be a lot of grinding. So what are like some outlets? And I was asked about this in my interviews as well. How do you de-stress? What are some outlets for you? For me, that's like dancing, exercising, weightlifting, yoga. So like for me, and then, writing. So I love to write. So they want to know, like, do you have a solid support structure in place, be it friends, family? So yeah, just basically be yourself. I like Dr. Munir said that he had a picture behind him. I used to have a picture of my dogs behind me. So they would always ask about, what kind of dogs do you have? Where are they? And then a lot of interviews have dogs. So our conversation would just basically be on animals in general. They just want to, so your interviews are going to be divided into two parts. They're either going to be some that they're very structured and they're going to be about your experiences and, your work, your clinical life. And then another part's going to be very casual. No structure to it. It's just going to be free flowing conversation. And it can be on anything in general. So it's up to you to kind of build that rapport with the interviewer, and that's what they're trying to see. You don't know this person, they don't know you, but can you still have a decent conversation with them? Yeah.
Sounds good. Sounds wonderful. Clearly, the two of you are very interesting applicants. So let's move into one last thing for this section is that how do we set ourselves apart for neuro, right? So some applicants obviously apply to two specialities, IM and neuro, or IM neuro and peds. Like they could apply to two, three. So how do we set ourselves apart for neuro? How do we make our entire application neurocentric compared to someone that's applying into IM or PEDS? Dr. Noor, why don't you set us off?
That's the billion-dollar question right there, right? What can I put on my CV so I match? I would just say this that you need to communicate very generally who you are, what your interests are, what your goals are. If you're interested in research, is there a research track that you want to pursue, for instance, in that university? But know what is your why? Why neurology? Why this program? And why should they choose you? And if you can cover these three in your personal statement and then your ERAS CV and also in your interview, I think you have a very high chance of matching. No
Okay,
guarantees, though.
that's it. That's great advice, Dr. Noor. Thank you. Dr. Monem?
I think it's very surprising that you brought it up and interesting at the same time because I was one of those applicants who applied into two specialities and I applied into internal medicine as well as neurology. So what exactly did I put on my CV? It's very hard to answer that question because you need to show the program directors and the faculties that you're very interested in one particular field, right? Because programs tend to not take those kind of candidates seriously who have applied into multiple specialities, for example. However, with that being said, I think one has to consider applying into multiple specialities, especially for people who uh, do not score well, for example, on any one of their step exams, and maybe want to cover a couple of deficiencies on their record. Maybe they have an attempt on one of their exams. So I think it would benefit a lot of those kind of people. And what exactly set my CV apart, I would just explain to the interviewer that I am very interested in neurology. Like Dr. Noor said, it is very important to have answers to three basic questions, which include why neurology, what set you up for this field, and what is it that you plan to do in the future. And I think couple that with a lot of other components on your CV, including good letter of recommendations, good publications, and good scores. I think that all plays in your favor and tends to make a holistic application that programs like to view at.
Thank you. Thank you, Dr. Monem. Thank you, Dr. Noor, for this advice. Let's dive into the next section, which is the scope of neurology, right? Once we match into neurology, and even before we do so, uh, people would like to know, applicants would like to know what is the expanse, what is the scope that is available at neurology, including fellowship options, different career paths, and so on. So let's start with fellowship options. And Dr. Monem, could you set us off?
Yeah, so a lot of programs give you the options to ask questions to them when you're interviewing with them, and a lot of applicants tend to ask about fellowships. So, with regards to neurology, a lot of fellowships are there, and a lot of programs are beginning to set up fellowship programs. I think most of the people tend to go for interventional procedures and fellowships associated with them. But I think with regards to neurology, epilepsy is a very good option. Neurodegenerative disorders, again, is a very good option. I think sleep physiology is something that I would be interested in. And stroke fellowships tend to gain a lot of interest from applicants with their come through with their residency. But I think whether you want to pursue a fellowship and in what specialty do you exactly, what subspecialty do you exactly want to pursue it, would be an answer best left to an individual who has just gone through the residency and has just completed it. Because during the residency, you open your mind to a lot of possibilities. Maybe, for example, I'm interested in epilepsy now, but when I am a PGY2, maybe I'm more interested in a stroke fellowship, for example. So it is very important when they ask you whether you're interested in a fellowship and what kind of subspecialty you're interested in. It's very important to answer this question in a very technical manner and maybe say that I am interested in a particular field, but I have an open mind and open to all possibilities.
Wonderful. That's great advice, Dr. Monim. Dr. Noor, would you like to continue?
Yeah, so when you are entering the program, do your research beforehand and see if they offer in-house fellowships. So for epilepsy, stroke, movement disorders, etc. And then if you come face to face in an interview with the department of chair for that subspecialty, then make sure you ask intelligent questions. Don't ask questions that are already on their website detailing, how many applicants per year for their fellowship, etc. You can also go into private practice. You can choose the neuro hospitalist route, which is like 1 week off, 1 week on. You can do locums. So there are multiple opportunities that a neurologist can take. You can even just practice general neurology and you see a little bit of everything.
That's great. So we have general neurology, we have hospitalist, and are there options to go into academia for neurology?
There are, and then you basically have to join and come in on as faculty. And these opportunities are very few and hard to get. There's a lot of competition. So again, it's like you have to basically first get that position by showing you have a very research heavy CV, and then you have to maintain that position by constantly applying for grants, K99, F, it depends on your visa and your status at that time, and have enough grants and funding to pull in for whatever research, clinical trials, or basic bench work that you're doing at that time.
All right, sounds wonderful. Thank you for this advice. Thank you for this insight into the scope of neurology. Let's progress into the next section.
Yeah,
Nawaz?
Shazib, I would like to actually take on this next section. I feel like it's very interesting. Let's discuss the actual match cycle, the match season itself, right? So now we've done all the prerequisites. We have a great resume. We have lots of volunteer experience. We've gotten our USCEs. When it comes to the actual match season, and we're writing our personal statement, what are we penning down? Dr. Noor, let's start with you.
What are we pinning down? Your personal statement is going to go through many drafts, many versions. Always have peer mentors, people who know you very well. They don't even have to be in medicine, who can review your CV for you and your personal statement for you and see, does this reflect who you truly are? And you don't necessarily have to agree with what they have to say, because at the end of the day, it's you who has to like put down their personality and sort of even their lives on this personal statement. And you can make it as personalized as you want per program. That's what I did. So I applied to 135 programs. So I made 135 personal statements. It takes time, yes. And you can just basically like at the end, change the name of the institution. So that basically shows them that this person is interested enough in coming to our program to make these kind of changes. Again, it all depends on how much time you have. And then, so what do you put down? That again, that's like the burning question. It has to be about your life. Why did you choose neurology? What was the path you took to come to this point in your life, and what you want to do in the future?
Right. Okay. And Dr. Muneem, what advice do you have for personal statements specifically?
I would like to advise the upcoming match applicants for three things, basically, when in regards to the personal statement. That is, number one, to start early. Number two, to revolve your personal statement around a theme. And number three, have it reviewed by several peers or colleagues. I did all three, but I did not make multiple personal statements for each program. It is a good thing to do. I think that would be a thing to improvise on in regards to a program that if you want to show that you're really interested in them, maybe personalize your statement for that particular program. But my personal statement was very dedicated to a theme. I'm going to go ahead and share the theme. Mine was a comet traveling through the skies, and I was an observer who was viewing this comet at the end of my telescope's lens. And I related the journey of the comet to my own in medicine. That was the theme of my personal statement. So I revolved all my experiences, all my personality, and the aspects of it that I mentioned in my personal statement around the journey of this comet. And I think it's very good to have a theme like that because it indulges the reader, it absorbs them in, and it's very important at the same time to have a very flashy and a very good and attractive opening paragraph, that because that is what the captures the reader. And to write a generic personal statement wouldn't help. I think that is what I would add on personal statement.
Right, right. Okay, okay. That's very useful. You mentioned in the previous section with Dr. Shahzeb, the importance of selecting programs, especially for USCEs that are IMG friendly or have a large or great proportion of IMGs in them. How important or how big a role does this play when it comes to program selection for the match itself?
I think it plays a very important role because you don't need to make the same list twice. Once you have already done it early in the math cycle, you do not need to go through the same list again. Maybe add a couple of programs, maybe tweak the list here and there, but you don't need to do it again. Which is exactly why I try to advise all my juniors, and I would advise the same to the viewers, that it's important to make a list early in the season and not just when the tokens or when you get the tokens for the ERAS and when you're actually working on the ERAS CV. Once you have made the list earlier in the season, it not only helps you find the IMG friendly programs, it helps you familiarize yourself with those too. So you need to know by the end of the season, you need to know what programs you have applied into, which IMG friendly programs are located exactly in which states. I was just talking to somebody this afternoon, and they applied into neurology last year, and they did receive a decent number of interviews, but unfortunately, they did not match. And what I deduced the reason, well, that is my assumption, but what I deduced was that the reason maybe they did not match was uh, they were not up to date with the programs, and the programs, specifically those that are IMG friendly institutions. So it is very important to stay in the circle. It is important to connect with individuals who are going through the same journey as you. Maybe make a Twitter profile, that helps. I know that we do not have a discussion on social media in this particular video, but it's important to connect with people on Twitter and maybe follow those who are specifically applying into neurology. Sometimes you may even find program directors for the IMT friendly institutions on Twitter, and maybe that gives you an opportunity to connect with them.
Right, right, Dr. Munim. Yeah, that's a very valid point, social media, and you're completely right in pointing out that we haven't yet discussed it. So Dr. Noor, Dr. Munim has already spoken a little bit about the role that social media and platforms such as X and so forth play. Could you comment on this a little bit as well? I saw you nodding along, so I feel you agree.
Yeah, I do. So you need to follow programs on Twitter, X, Instagram, follow the PDs on LinkedIn, follow the residents, see what kind of CV that the residents that have recently matched have built over the years, see how maybe you can kind of echo and reflect that. Obviously, you can't have the same CV, but on Twitter, X, and Instagram in particular, if you follow the pages, they basically post the dates of their open houses. So you can go and then you can reach out to those residents and ask any pertinent questions that you may have. And again, it's very important to choose those programs where the residents have a similar background to you.
Right, right. Okay. And when it comes to program selection, recently and in the coming years, signaling plays a very important role. Could you speak a little bit more on that?
So this year in the coming cycle, there are going to be 8 program signals for neurology compared to the 3 that were used in our cycle as per American Academy of Neurology. So signals and geographical preferences are now being used by the program to screen applicants. This signal allows you to signal the top choices, so the top 8 choices, and also lets the PD know that you're picking their program that you want to be interviewing at. They do holistic reviews of your application, but in reality, if you get around 1,200 applications, how are you going to realistically sift through them? So when they receive the signal, you are at least guaranteed that they will review it once. And same goes for geographical preference. If there's a place you want to live, you should express that. If you have family in Texas, then you want to train there versus you not having a geographical preference, you can state that as well. In either case, you have to justify why you chose. And PDs can also see if you did not choose their geographical preference as yours. So that is something to keep in mind as well.
Right, right. And Dr. Monem, what would you like to comment on and or maybe elaborate on this geographical preference that's been brought
I
up?
think I think Dr. Noor adequately covered that. If there's a location that you want to stay at, one of the interviews I received was from New Jersey, which is um, right across New York State. So it is in close proximity, although not the same state. I did mention that I would like to be close to that area. Um, it is important that you show a connection to a particular setting. Maybe if you have a family there, it's important that you mention them that I would prefer this particular area because my family lives there. It absolutely helps the programs to screen those kind of applicants who wouldn't have to travel that much or that far often when they're on holidays as residents, for example. And as far as the signaling is concerned, I think signaling is very important. Again, like Dr. Noor stated, we as applicants had three signals, but in the upcoming math cycle, there are going to be 8 neurology signals. Some of the programs do absolutely consider signaling, some do not. But I have a personal feeling that in the upcoming math cycle, there are going to be a lot of programs who consider signals because, like Dr. Noor said, when a program is receiving an average number of maybe 1,000 or 1,100 applications, it's very hard to sit through all of them and have a holistic review of each one. So programs will and already have use signals, and they screen out these kind of applicants who are really interested in them, and then the screened applications are gone through, and those are the ones that are eventually interviewed.
Right. Okay. Okay. Right. Okay. So now we've done the necessary and we've signaled and we've, indicated our geographical preferences and we're now at the interview. What do we do here? How do we, secure it? So let's just start with Dr. Noor.
Again, what you need to come across as somebody who's very genuine and real. Do your due diligence beforehand and do your research on the program's website. The website is amazing. They give all the information for every single program and specialty. See what the residents are doing, where the faculty is from, what research are they involved in. The night or before the interview, you usually have a pre-interview dinner or meet and greet or happy hour with the residents. See the culture, see the vibe. Would you think you will gel with them? Is it just like something that it looks good on paper, but how does it look in person? So it goes for you and for the program. So, and then during the interview, again, just be very mindful of who you're speaking to, be very respectful of their time. And then if you get to interview with the chief or the residents, you can ask them how is residency for them. So even if the interview is set in a casual setting, then even then you're being assessed and judged on your communicational skills, how you present yourself, and whether whatever your LOR preceptor said about you, can you back that up by how you are speaking to them?
Right, right. Dr. Monim, your thoughts on interviewing?
I think interviewing is very important, but some of the things are universal that apply to all interviews, which is to be very fluent in your English language. Communication is the key. And I understand that not a lot of applicants, specifically coming from Pakistan and other countries, specifically those who are IMGs, they do not some of them do not have fluent English language or spoken skills. So it is very important to start practicing early in the season. Maybe try to talk to as many people in English as possible, not just in Pakistan, but also in the United States. When you're trying to interact with someone, be very professional before and during the interviews. Absolutely attend the meet and greet sessions. I agree with Dr. Noor because that gives you a window into how the program is, how the residents are, what they tend to do in their free time, and what are some of the places that you can visit in and around the program. So these kind of things are universal. And do your thorough research on the program when you're interviewing for one. Scour their website, absolutely go through it, and um, I think it's also important to look at the faculty, their backgrounds, where they come from, the residents, what kind of residents a particular program tends to hire, and what do the residents have in their application that will help you in your interview as well. So these are some of the things that during the interview would help an applicant dress professionally and be very respectful of their time. Be very respectful when you're communicating with them. Uh, these are some of the things that would help you secure an interview.
Right. Okay. Right. So a lot of this sounds like networking, right? Networking, we all understand to be very important, but it's something that can be a bit intimidating for people to get started with. So how would you recommend that, and when would you recommend people start networking specifically for neuro? Where would you start? What would you do? Dr. Monim, why don't you continue speaking on this?
Absolutely. So, when talking about networking, this has been a subject of hot debate and discussion over the past few math cycles because considering how competitive the math cycle has become, not only for neurology, but other specialties as well, including internal medicine, family medicine, emergency medicine, networking is absolutely important. And I think tend to classify networking in two broad ways. The one that you have natural connections. For example, maybe you have a relative working at some program. Maybe you have a senior working at some program as a resident. You can reach out to them and try and absolutely do it earlier in the season so they have ample time to recommend your application, for example. And the other sort of networking is on-site networking, which I tend to call it, which means when you're, for example, going for an observership or a rotation at some program, you can maybe, even if your rotation is not specifically related to a program, maybe you can go and introduce yourself through the residents nonetheless. Maybe you can go meet the program director. For example, during my rotation at the Cleveland Clinic, Ohio, I met the program director, even though my rotation was not strictly related to the Cleveland Clinic's neurology program. There, I did go to the program director of the Cleveland Clinic, and I introduced myself. I told them that I absolutely love the program. I see that they have an IMG setting there, so I would love to be a part of it. I introduced myself that I'm working with this particular physician, and he was like, "Oh yeah, I do know that person, and he's a very jolly dude." So I think it is very important that you go out of your comfort zone and try and connect with people. But then again, it's very important that you do not bother them. You stay absolutely professional. You do not spam their emails, and you do not you be respectful of their general attitude.
Right, right, right. And Dr. Noor, with research, with so much going on, how would you recommend people go about networking?
So one thing that I'm asked about and approached about a lot is basically how do you make connections if you don't know people to begin with? So like Dr. Munam, I'm also a first gen doctor. So again, like I had to start from scratch. So you need to actively seek out these connections. One really good way of doing that is coming to conferences, be it even if you're not presenting, make new friends, be curious, have an open mind. Simply get in the habit of approaching people, introducing yourself very politely, and then, saying, I'm working on so and so project. I see that you're working on this. I would love to collaborate with you someday. Can I have your email address? And most physicians are very, very welcoming, everybody in USA, so they will love to at least touch base with you once. And then the onus is on you to follow through. So if you've presented there, you've been to conferences, then PDs know you're a neurology applicant. So that is one great way of doing it. Another way is basically building up your, just getting in that habit of asking for help and building up your circle, asking your peers, and then from there on, then asking either your teachers and then people you have done an elective with, ask them, can you work? You don't have to necessarily do a postdoc, but you can do just like, work on a simple paper with them, and then maybe somewhere down the line, that paper can prove to be an interview for you in the future.
Right, right. Okay. I have a bit of a throwaway question for our audience here. What is the lowest yield or the lowest effort thing one can do to really increase their chances of matching into neuro? If there was one thing you could recommend, it's just you do it and it's the highest impact. What is it? What would you say it is? Dr. Noor.
That's a very tricky question. Having a great personal statement, I feel like is one, and at least having some kind of USC experience that's directly related to neurology. So at least you can get one LOR out of it that's written by a physician who is practicing in neurology. Something to back up what you're saying with your personal statement that yes, this person is passionate about neurology because that's what PDs want to see at the end of the day.
Okay, okay. And
And
Dr. Monin, what?
there are no guarantees and there's no like one set rule as to you will do this and then you will match in neurology.
Of course. No, no, that's for sure. But of course, we do want to give hope to people. And Dr. Monin, what would you
Yes.
say is one thing you would recommend that if someone does, their chances of matching goes up by some random number?
I think the match is uh, um is a collective effort of a lot of things and a lot of people behind your back. So, with that being said, I think there is no such thing that I would say would absolutely guarantee your chance. However, I think it's very critical and important to have a volunteer experience or maybe a hobby that you can add to your application because it gives you a lot of material and substance to talk about during your interviews. I think a lot of applicants tend to ignore that last part. A lot of people have hobbies, but they are generally too bizarre or maybe they're just too boring. But it's important to have one nonetheless. And I think when you're talking about your hobby and making important difference in the eyes of the interviewer in a sense that they know that this person has good communication skills and can talk about something for hours. This plays in your favor and the overall judgment of those people when they're interviewing you. But with that being said, once you have secured an interview invite, half of the work there is done. And now you just need to do the convincing part, right? You just need to convince the program that, yes, you are the correct fit for them. And with everything that's been discussed in this video before, I think all of those things collectively play a part uh, uh, in leaving you in a very positive position when you're practicing your interviews.
Right. Okay. Okay. Thank you. That was a very tricky question, but you both handled it exceptionally well.
Yeah,
I
just
do.
echoing on what Dr. Manu was saying that you can just match with one interview. It's rare, but it's been done. So the saying that you just need one interview to match, that's very, very true. You just have to basically, even if you get like 10, 11 interviews, you have to treat each interview as it's just the one and make sure you give it your all and stop thinking about all the other interviews that you have gotten and just make sure that this is that one interview that gets you your match.
Right. Right. Okay, Dr. Noor, you said you applied to 135 programs, is that right? And
For
then you
neurology.
interviewed, right? And then you were interviewed. How did you determine your rank order list? What sort of factors played a role there?
For me, so what I would like to call is a local culture. So you need to see if they're a good fit for you. You've interviewed with them, they obviously like you because, they sent you an invite, and you can kind of see how and assess how, you would be and how you would be ranked for them. Did you have a good interview experience? Was it mediocre? So it's important that you get along with your fellow residents and the attending. So you'll be working with them for around 4 years. And then in the future, when you're applying for fellowships. And after that, your employers will call your program and then ask, was this a good resident? So imagine how the conversation would go if you did not click with the attendings. It's very important. So I recently got to meet my program and their attendings before starting residency at AN where I was presenting. And um, it absolutely, like, without a doubt, I know that this is the right program and the right fit for me because just the culture, the vibe, how everybody, the residents and the faculty are meshing, it's a different experience altogether. That's why I would also recommend asking about second looks in your interviews. So after the interview is over, you can shoot the PD or the program coordinator an email saying, "Can I come for a second look?" A lot of programs have started doing that. My program did that. They already decide their rank order list. It's actually for your benefit. If you have the time and the finances to cover that trip, you can go and see that program. And that will definitely help you in making your rank order list. Some programs moved up and down for me because of the second looks I attended.
Okay, and Dr. Monim, what would you say?
I think rank order listing is very, very important. And a lot of people don't understand how this works, but I would appreciate if the viewers mention the link of the particular NRFP video, which is there on the YouTube in the description of this video. So I think it's important to consider your preferences first, that because that is exactly what the algorithm does. And it's important that you see that whether you are a good fit for the program, number one, and whether they are a good fit for you as an applicant. And that would consider a lot of factors, maybe even the geographical location of the program. If a program, for example, is located in a dangerous neighborhood, I personally wouldn't prefer that. But if a program that is located in quiet neighborhood and they also have a good fellowship program, for example, associated with them, I would rank that program higher on the rank order list. But another important factor that plays into it is the visa status that is being offered by the programs. Some applicants tend to rank the programs which offer an H-1B visa higher than those that offer J-1 visa programs. So a lot of factors play into deciding what is going to be your exact rank order listing. But the first and foremost of which is you see whether a program is a good fit for you as an applicant.
Right. Okay. Yeah. Thank you so much. Right. So now we're on to the final step. We've matched. And what sorts of things do we have going on now? Like, what are the post-match tasks that you have to do or are recommended? Dr. Monim?
Oh, that is a very good question because once I matched, I personally felt at ease. A lot of burden is off of your shoulders, and you just tend to spend the rest of your time with your family before you travel to the United States. So that is exactly what I would recommend. First and foremost, your physical and mental health is very, very important. Not only after you have matched, but also during your USMLE journey. And a lot of people tend to ignore that because while when they're preparing for their STEPS exams, they're really and truly dedicated to it. That is a very good thing. But I think physical exercise is important. Listening to music and pursuing your hobbies is also important for your mental health. So that is exactly people tend to advise, and I would advise the same, that spend the most of your time with your friends and family before you travel. And also get in touch with your co-residents, see what exactly they did during this time, what it is, what are some of the things that you need to consider when you're going for, as an intern into a program. What are some of the patient management strategies, for example, that you think would help you right then and there when you're jumping into residency? And it's also important that you fill your paperwork in time because once you have matched, a lot of paperwork is being sent out to you by the program. It's important that you complete it. Don't miss your deadlines, and file your application for in time if you're matched at an H-1B visa program, and complete your J-1 process in time. Those are some of the things that I would recommend.
Hey, Dr. Noor?
Oh, yeah, match week basically when it happens on Monday, you find out if you matched, and then on Friday, you find out where you matched. So when I found out where I matched on Friday, like literally 2 minutes after receiving the email, my program director called me and congratulated me, said he was so happy to have me. Hope you're happy to have us. I thought that was amazing and so sweet of him. And then after that, there's like a barrage of emails that start coming and talking about like all this huge checklist of things you have to go through, not just from the program, but things you have to take care of on your end, statement of need that needs to come through from Pakistan. And then you also like for someone who's doing a postdoc, you have to convert your J1 research status to J1 clinical. That's like 10 other documents that you need to send in. So your research program, your new program, and your home country, they're all basically, it's like, and you need to stay on top of everything. You need documents and paperwork from all of these. So it's a lot, and like Dr. Munir said, to stay on top of it and make sure that you fill out any deficiencies, any paperwork. Make sure before the math starts that everything that you have is started, like your passport, your house job certificate, statement of need, whatever you need. Make sure that it's there so that you're not panicking come March, and then because you only have around like 2 months, a month and a half before you start residency. Yeah.
It's interesting that you brought it up because that is exactly what happened to me as well. Right after I found out where I'm at, the program coordinator called me as well 2 minutes after, and she congratulated me and she said the exact same thing that your program coordinator told me. And she was like, "We're really looking forward to having you here, and congratulations." And uh, yeah, I think that is a very good gesture by the program, and I think those are some of my recommendations after you've met. It's interesting that you've kept this question at the end of this video because a lot of people don't address this part. I think that
Yeah.
it is very important.
Perfect. Thank you on behalf of all of MedAngle and the audience watching. Thank you, Dr. Monim. Thank you, Dr. Noor, for your advice, for your energy, for your insights, for your effort, and for your time. Right? It has been an especially productive session, I'd say. And I am very sure, including me, that the audience watching in is going to derive tremendous value from this, from the match process for neurology. Right? As always, Marangal is committed to revolutionizing medical education in Pakistan and beyond. For more resources, check out our website. And for more episodes on specialty series and our previously conducted It's a Math series, please check out our Marangal YouTube and our socials as well. Have a great night, everyone, and Allah Hafiz.